What is the best and most effective way to take buprenorphine?
What we normally do is prepare the dose in a clean small cup so that the patient can put the medication under their tongue. Sometimes we'll actually fragment the tablet a little bit so it is easier to place under there. We certainly don't crush it because it tends to dissolve all through the mouth and then not be absorbed very well. We would ask people not to talk very much or at all while they have it under their tongue. That tends to disperse the tablet. If they find that they can't actually keep it under their tongue, just tilting the head forward a little bit often brings the tablet back under the tongue where it should be sitting, and that's the best place for it to sit to slowly dissolve. You aim to get the most benefit by keeping it as long as possible in contact with the area under the tongue.
And that's what sublingual means. It means absorption under your tongue. And underneath your tongue, you've got these blood vessels that allow the absorption of a drug directly into your bloodstream. And that's really important, because if you swallow a drug, it gets broken down by your stomach and your liver. Now, that's fine for some drugs, but buprenorphine gets broken down by your gastric juices in your liver, which means that the amount of buprenorphine that gets into your system if you swallow it is really tiny. You're wasting your money. Well, you're wasting the Commonwealth's money, to be honest. The problems with taking a tablet sublingually is A, keeping the tablet there. That's much easier to do if the tablet's given to you in a whole tablet or broken down into a few pieces. We understand if a tablet's crushed into a powder, it bubbles up, froths up, floats all over your mouth, it tastes a bit horrible, and A, your sublingual veins can't absorb all that fluid at once, and if you've got something that tastes a bit horrible in your mouth, you're probably going to end up swallowing it, so it's not going to work. But the takeaway message is, the longer it takes for the buprenorphine to dissolve under your tongue, the more you're going to absorb. I know I said it was the last thing, but there's one other thing. The more tablets you've got under your tongue, the more difficult it is to absorb. And so if you find that you're on a dose of above 16 or 20 milligrams of buprenorphine and you can't just hold that many tablets under your tongue, tell your pharmacist, tell your clinic, and what they'll probably do is offer to dose you in 2 separate bits. What I want to go through is the different ways that you might be given buprenorphine and how this actually might affect how you absorb it. So, what we have here is an 8 milligram tablet of buprenorphine naloxone, otherwise known as Suboxone. Here we have an 8 milligram tablet of buprenorphine, trade name Subutex, and here we have a 2 milligram tablet of buprenorphine. What we have at the end here is those tablets crushed into a powder. Now what I'm going to do is show the difference in terms of how long it takes for buprenorphine tablets to absorb by taking the average dose in Australia, which is around 12 milligrams, in 2 different ways. What I'd like to do is keep an eye on the clock in the left-hand corner of your screen so we can see how the different preparations affect how long it takes to absorb. So, thank you, Thing. Here we have 12 milligrams of buprenorphine crushed into a powder. Normally this will be handed to you and they'll ask you to tip it under your tongue, and then the dispenser may want to confirm that it is under your tongue. The general advice is to keep it under your tongue, keep your head forward, keep your tongue down. If you do find yourself salivating a lot, it's much better to draw the saliva around the side of your mouth. So here we have 12 milligrams crushed buprenorphine. Although these are only placebo tablets, it does taste a bit horrible. And I actually couldn't keep that under my tongue any longer. Now, it may be that the placebo and the real tablet have slightly different times to dissolve because of their slightly different composition. Anyway, it's all gone. And normally after dosing, what you might be asked is either to have your mouth inspected. Some dispensing points might ask you to take a glass of water, to swish around your mouth. A really good thing to be given, of course, would be something like a sugar-free lemon drop, which might stimulate some saliva and therefore reduce any of the kind of salivary drying up effects that some of these medications have. What I'd like to do now is repeat that absorption process, but instead of using crushed buprenorphine, I'm going to take 12 milligrams of buprenorphine placebo that's been broken into bigger bits. Thank you, Thing. So here we have 12 milligrams of buprenorphine that instead of being crushed has been broken into pieces. The 2 milligram tablets of buprenorphine have not been broken. And again, keep your eye on the left-hand bottom of the screen and we'll see what the difference is in absorption times. And it's all gone. As you can see, crushed, it took less than 2 minutes for 12 milligrams of buprenorphine to be dissolved and absorbed. But when it was given as broken bits or whole tablets, it took about 5 minutes. The general view is that the longer it takes to dissolve, the more contact there is between the solid bits of buprenorphine and the vessels underneath your tongue, the more you're going to absorb. And it really is important to remember that buprenorphine is only absorbed by those blood vessels under your tongue. If you swallow it, you might as well be spitting it out.
What is the best